Hello, welcome, welcome. Right.
Hello.
Hello, welcome.
Hi,
Yay.
Lisa. Hi, Jocelyn.
Yes.
Hi.
Those
Hello.
faces,
There's some
What?
great faces.
those faces.
Yes.
Wonderful. Well, thank you everyone for joining us today on Giving Tuesday. What a happy surprise that we end up gathering on this day. But my name is Melody. My pronouns are she, her, hers. I am a board member of the San Diego Human Dignity Foundation. If everyone can take a moment, make sure that they are muted. We will have opportunity to have a Q&A type of interaction at the end of every presentation. Aside from being muted, if you can take a moment and make sure that you rename yourself with your name, your pronouns, and if you're here with an organization, you can add that in. Zoom does not have a limit on the amount of characters that you rename yourself in, so feel free to put a novel if you so choose. But we are very happy to find ourselves on Kumeyaay land. We'd like to give a little land acknowledgement. The San Diego Human Dignity Foundation recognizes and respects Indigenous peoples as traditional stewards of the land. Specifically, we recognize the Kumeyaay people whose ancestral homelands the city of San Diego is on. A little bit about the Human Dignity Foundation. We currently have 10 board members. Is that correct, Lena?
We do.
Yes, 10 board members. We're comprised of a diverse representation of the LGBTQIA+ community. Our mission, our most basic job is to be an efficient vehicle for implementing charitable gifts. As our capacity to make grants has grown, we've also become a knowledgeable partner in guiding donor contributions. As our assets and granting capacity continues to expand, we will play an increasingly vital role as community change agents and leaders. So today we are very honored to have two very amazing organizations that receive grants from the San Diego Human Dignity Foundation. We have Stepping Stone and we have Neighborhood House. We're going to begin with Stepping Stone. So today we have a couple of very special people that will be talking to us. Hello, welcome, Chris and Pam.
Hi there.
Hi there. Thank you. Thank you for having us tonight.
Our pleasure. So I'm going to leave you to it to let us know a little bit about the organization and specifically our special relationship together.
Okay, well, first off, we'll share a slideshow that's been created, and then we'll go ahead and give you some more details about our relationship and how wonderful it has been working with you.
Share.
There we go.
Okay, so Stepping Stone is San Diego LGBTQ Treatment Center. So I'm Chris. My pronouns are he, him, and his. And Pam is with me.
Mine are she, her, and hers.
So we will, there's a lot of information here, so we'll just skim through it. So Stepping Stone has been providing services to the community for 43 years. And about 50% of our clientele at residential are HIV positive. And we do have 3 sober livings, 2 which are funded through HOPWA funding for clients with HIV. And several years ago, we opened another one called Alice's House. We do have an outpatient location, and the grant funding over the last several years has been used to help Pam over there with her outpatient services.
So some of the reasons that we provide specific substance use disorder treatment to members of our community, there's a whole lot of stigma associated, not only growing up LGBTQ, but also with HIV. And a lot of times when people experience that kind of adverse condition or trauma, right, it's very natural for them to turn to substances and to, over the process, develop addiction. So stepping out we got started again. It's our outpatient services back in 2018, and we're very limited in our funding. We're fortunate our board does a lot of fundraising. It supplements what we get, and we have organizations such as your organization and the HIV Funding Collaborative to help us. So when we first started in 2018 and we first got this grant, our money went primarily to, well, not primarily, totally to provide therapists. At that time, we had no other sources for clients to have therapy, and it is instrumental in helping them overcome, a very strong addictive process and to deal with some of the trauma and the adverse conditions that they've experienced in the course of their lifetime. Fortunately, over time, we have been able to subsidize that in different ways. I now supervise students, and that's very helpful. We do still use the money for one or two therapists when we get so many clients. We do use it to fund things. We also implemented this past year a program of one of the evidence-based programs in the treatment of methamphetamine disorder is intermittent reward system of some sort. So we've started doing that to kind of boost the serotonin. It does some things in the brains that help clients to stay clean and sober. So this is a sign in our lobby, and this is what a lot of people who are familiar with Stepping Stone say about our services. They feel like they've come home. We welcome everybody that walks through our doors, regardless of where they're at. As long as they want help of some sort to deal with their substance abuse issues, we're able to provide that help. They don't have to meet a requirement of necessarily being able to stay off of substances. We're lucky where we can provide a continuum of care that goes all the way from outpatient services. Sometimes they move over here into residential treatment, and then they go back into our services and our sober livings. So it works out really, really well.
And one thing that Pam's been able to do is she's never closed the doors over there during this COVID pandemic. She did get right on Zoom, but the doors are always open for those, coming off the street, needing help, or just want a live person to meet with and, meet them where they're at.
One of the things we found, I was very fortunate at the time. I had a student who actually created online educational sources. So we were able to do that very quickly. But a lot of our guys get very triggered by computers, by the internet, by programs like Zoom. And so what we did is continue to provide therapy. We didn't have group therapy, but we would continue to provide one-on-one therapy. They can meet with their substance abuse counselors or their therapists. We have a huge room. We could do it in a way that still protected everybody. So this is where we're located currently, hoping to move, but right now we're still over here. It's on Illinois Avenue, 3928 Illinois Avenue. It's the storefront of some apartment buildings, and a lot of great work has come out of there. We do provide very individualized care. Once again, we don't turn anybody away. The client gets to define what their goals are, as long as they're struggling with substances. That is the one so-called requirement that we have according to the state. So we do a lot of group treatment. We provide up to currently, I think it's 13 or 14 groups a week. So there's a lot of education process that goes on there and a lot of help, and they get help from each other. They learn to support each other. Here's the group schedule. So we do have groups, a couple groups later on in the afternoon and evening for people who are working during the day, and also on Saturdays. So there's a wide range. And this is the last slide. Some of our pictures from our Living Out Loud gala that we had this year. The money that the board raises through that gala does go towards outpatient services. So it's very important. And some of you might recognize some of the faces. There's Cheryl, there's one of our therapists there, and Alice, who's been here forever.
And with Alice, we did name, we have our new sober living on 35th Street in North Park, and we named it after Alice. It's called Alice's House. And Alice has been a volunteer at Stepping Stone for about 40 years. So she's been here longer than Cheryl. She still comes weekly and does a couple groups here. She takes the clients on walks to the beaches. She does groups at Pam's program, and she's quite an amazing woman that we're lucky to have involved with Stepping Stone.
She still meets with clients who went through this facility back in the early 80s, you know. Yeah, I know, it's pretty amazing. So she stays real connected, and is one of our, you know, very important volunteers. All of our volunteers are very important. But so, like I was saying earlier, the HIV Funding Collaborative has done a lot to help Stepping Out get on its feet, to provide therapy for clients, to help us with trauma-informed care, right? And we're very grateful. We're very grateful to all that you provide for our whole community. It's really impressive work that you do.
So a couple questions for you two. Where do you get your client referrals?
So our client referrals, they'll come like through UCSD, Family Health. Dallas will send us individuals, the Gay and Lesbian Center. So, and just word of mouth in the community and outside of the community, we have people, you know, that will seek our services that come from all over the United States.
And prior to COVID, we did a lot of outreach. So we were going up to the North County Gay and Lesbian Resource Center once a week. That stopped with COVID, but we still are doing outreach through them to help members of our community, you know, up in North County. They don't have a specific substance abuse treatment center that's geared towards their experience. So.
And before I open it up to everyone else, since I'm monopolizing this time, but my question would be, do you have maybe you don't have to name names, obviously, but maybe a personal story of how Stepping Stone has helped an individual?
I have a personal story. I won't name any names or anything, but years ago we had a client who came through our doors at the time who never even was aware that there was such a thing as substance abuse treatment. And out of all the clients, I mean, I've been in this profession a long time, he has got to be somebody who was suffering greatly from addiction. His life revolved in my brain, not, you know, kind of like a golem, the ring, methamphetamine, until he walked through our doors. He was diagnosed with HIV. He hadn't had medication in years. He was losing his eyesight. There were just all sorts of complications from having, you know, untreated HIV. Well, he was diagnosed with AIDS. And he went through our program. He had some very difficult times. I can remember one time in particular, but he heard that message, just don't leave, no matter what. And I am so blessed lately. This past year has been a blessing because I've got to see him a couple of times. You know, and he has years of sobriety underneath his belt, and he has his own place to live again and his own vehicle. And he's, you know, employed doing, you know, I don't know if he loves what he's doing, but he's gainfully employed. So he's, you know, he's one of many that just, you know, touched my heart. He came such a long distance in such a short amount of time. So.
And then I have an additional story of someone who went through here 8 years ago. And the important thing of us being so consistent in the community, you know, when this person, when the wheels really fell off, was able to reach out to us, and with outpatient, you know, being able to walk in those doors and at least get the process started. And, you know, this individual is currently here, you know, working to get his life back, and just, you know, made a comment earlier today, you know, just that he feels safe here and trusts everyone that works here. And, you know, that's what Stepping Stone is all about. That, I know, is what your foundation is all about, is really helping to make our community a better place. And, you know, to all of us to open our arms, you know.
And very quickly, just a quick story on how we all work together as well. We brought somebody in to outpatient who was in had several traumas, transgender person, came into outpatient, and we worked there to get this individual stabilized until we could bring them over here. And once they came over here, they spent quite a while with us, about 9 months, and they went into our sober living, came back to outpatient. And there had been so many things, we were able to reach out to Fraternity House and work with them to get a permanent placing for this person who really needed that support. So, I think the fact that we all get to meet together online like this, or when we could in person, also helps, because we get that opportunity to see, what other kind of services are out there. Let's make connections so that we can, help each other out.
And with the person at Fraternity House, they're able to reach out to us and we're able to provide additional information that they need for that person. So it's like a family, the person is no longer down here with our services, but up there. And, we're still working together. And I know that Fraternity House is one of the agencies that receives funding from the San Diego HIV Funding Collaborative.
Yeah, it definitely takes a whole village, I feel like, and working together accomplishes so much more. Anyone at this time can unmute themselves, ask any questions, or you can throw it in the chat as well if you don't want to ask aloud. Pam and Chris are here to answer any questions on Stepping Stone, what their mission is, or their relationship with the San Diego Human Dignity Foundation. Does anyone have any questions?
I do. I'll wait.
Should we have hands up?
Sure. Who wants to go first?
I'll go first. Hi, Pam. Hi, Chris. I've had great experiences with you and some clients that I have sent to you. You don't always know. And the problem that I'm looking at, where are you possibly moving?
We've been looking for a while now, so it would be close. Once again, we're trying to find something that's central to our sober livings and to here, so that we.
Okay, great. Most of the clients that I have that would have your services are in Central San Diego.
Mhm.
Yes.
That's the
Yeah,
majority of
That's
our
where we're
clients.
staying.
good. That's a good thing. And the other thing is, I've had problems lately because some of the LGBTQ folks that I tried to get into Stepping Stone refused to go there because they were too well known.
Mm.
And I'm really at my wit's end because you guys do a better job with substance abuse than Mesa Vista. And I've consulted in Mesa Vista. So I know they do a great job, but with LGBTQ, you have a better or a lesser revisitation rate with LGBTQ than they do. And it's basically cultural and custom that they're having a problem with.
We've encountered that, and it's challenging, right? Because like an outpatient, they come into groups and they're with other members of the LGBTQ community. And whereas professionals, we definitely can assure their confidentiality. We can ask people to keep everybody's confidentiality. We can do our best to remind people prior to every group, but can't guarantee it. But we have tried. I've had some doctors come through our program, different people from different levels. We take insurance clients as well. So, and yes, I do think, I've also encountered somebody who is just like, can't do this. I'm too well known and I can't do this.
And we do work with like other organizations that, are like in Palm Springs or Los Angeles to get the person out of town for a while. But a lot of that is like insurance-based treatment. So
that's good to know. I actually forgot that. I'm sorry.
We've actually also sent one of our clients once, quite a while ago, to a nonprofit in Palm Springs.
Right. We did very well. 2 of the clients. So.
Okay, I'll remember that. And the other thing, I hope can I do a little talk on what I'm doing now? I'm no longer connected. I'm no longer.
Yeah.
I'm no longer connected with Human Dignity Foundation, and I'm afraid people are going to think that that's what I'm still doing.
Yeah, no, you can't, but let's, we still have another presentation to do. So let's make sure
Okay.
we do in the timely and see if there's what's left at the end, and then you can share.
Okay. But I need to contact, I need contact because I'm also doing private clients. And I really like what you guys have done. Do you still have an outpatient program?
We do, yes.
Fantastic, fantastic. Thank
I'll
you.
post my phone number. You can give me a call too if we don't have a chance.
And I'll get a hold of you, Jocelyn.
Yeah, you got my phone number.
I know.
It's on speed dial.
It is. Okay.
Go ahead, Aaron.
Okay, so even though I'm not in California anymore, I am still on the board for the foundation.
You okay?
And y'all get site visits once in a while, but my schedule doesn't always allow. I'm wondering if I could stop out next Thursday or Friday to visit, because I will be in San Diego doing some work for the foundation.
That would be great. That would be great. I'll put my phone number in the chat and just give
Perfect.
me a call and we will make it happen. I look forward.
I know to
seeing
text you, Chris. You respond that way fast.
Okay. Yeah.
Yeah, no, it's a great facility. Robert and Maddie and I were lucky to go a few months ago and visit. And we did meet Alice. So when you shared about Alice, it's like, she is just amazing. And then we saw her again at the gala, and you know, we saw her, we had to go over and say hi because she is just an amazing woman.
Well, thank you so much, Chris and Pam, for talking about Stepping Stone. I did put in the chat their website so you can see any more information. And we are just really excited to continue our relationship and continue to see what Stepping Stone does, and then possibly finding a new home and visiting the new place. So more to come on that. But also with us is Regina and Dallas, who are representing Neighborhood House. So tell us a little bit more about your organization and our relationship with the San Diego Human Dignity Foundation.
Sure. So I'll start it off here, and then we'll kick to Regina here. But hi, everybody. I'm Dallas. I'm a supervisor at the Coordinated HIV Services. I think the great part about this community is that all of these faces look familiar. And I think that's something that we have going for us, right? I mean, everybody works together. And even when Pam was telling the story about the client that's a success, I mean, I was thinking that might be my client that just got out of there. So that's the great part about this community. And the great thing about Human Dignity Foundation is that we get a chance to share the successes, share the things that don't work, and it's kind of a judgment-free zone where we can kind of ask the tough questions like Jocelyn was just doing, right? Where it's like, what are you going to do in this case, or what are you going to do in that case? And then those are the things that are really effective, right? We don't just answer things status quo, like, oh, you know, like we'll get to it or whatever. So I just wanted to touch on that. But so I've been with the organization for about 10 years. I am also sad that we're not doing this at the Opera House or whatever that building was that was so beautiful, because that was great a couple years back. And so, yeah, I have a slideshow ready to go. I'm going to first let Regina kind of introduce us a little bit, and then I'm going to share my screen here. Okay.
Thanks, Dallas. Good evening, everybody. I'm Regina Underwood. Just the camera a little bit. And I've worked with Dallas for about 10 years. Neighborhood House Association Coordinated HIV Services Program, or CHIVS, which is much shorter to say. And I've been at the agency for 23 years and in the HIV program for 18 years. And I just would really like to thank the San Diego Human Dignity Foundation for your support and your funding for the last couple of years. We really appreciate it, and it really helps us to provide more services for our clients who really need it. So we really do appreciate it, and just glad to be here this evening with you.
Cool. Thank you, Regina. And so the funding that we use from the Dignity Foundation, a lot of that goes towards transportation, towards other services that directly help the clients. We offer Lyft rides monthly. We can get a couple one-way Lyft rides for clients. We do Pronto bus passes. The old Compass card is now the new Pronto. So we do that, and we can pay for that on a monthly basis. And then all the other services that we provide are pretty standard to case management agencies, but just to go through it for some of you that might not be informed on it, we help with short-term housing. That's SROs, hotels, and that's been a huge sort of gap that we've been able to fill during the COVID pandemic, especially in the beginning. We do move-in rent, and this is all through NAMI, which you guys are, I'm sure, familiar with, who run the contract for ERP, which basically stands for the emergency pool of money that we get from Ryan White yearly. So we are a kind of a one-stop shop for everything HIV related when it comes to services for housing, transportation. We also have a clinician in the office. He's an AMFT. So we have mental health and substance use, one-on-ones. We do groups and televisits. And then just recently, we were awarded 2 different research grants from the IRB through UCSD in coordination with a couple other agencies to do some research on substance use and mental health. So it kind of just shows, and just to, I don't want to be too like conceited about it, but it kind of shows you that we're always constantly trying to add more, right, to our table. And I mean, anyone that does case management and then stepping stones, of course, and all of us, I mean, we know that every day could be an hour longer and we'd still be busy. Um, so with that being said, I mean, this is dedication, right? So Regina and I, we've been working together for 10 years. So we have a lot of history together. We have clients that have been with us all 10 of those years and sometimes more than that. So it's a really cool thing we got going. And with this slideshow, can you guys all see the front page of the slideshow? Okay, so this is it's going to be a little bit different, right? So this won't kind of go into like the basic information about what we do. This is going to be kind of a interactive sort of presentation on the things that we've had to change since the pandemic, considering this grant was given to us in a year where there was a lot of strife and turmoil. So I'm going to kind of go through this, and it'll be interesting for you guys not in the case management field to sort of see how we've had to navigate this. Okay. So let's see here. Okay, so first thing that got impacted big time was the outreach. Outreach got pretty much brought down to zero when the pandemic started. They didn't want anyone going out and especially, getting on the street level with clients. I mean, the idea was to get people off of the street and somewhere safe, right? So what we've done and what we decided to do, and this has always kind of been the case, is that we kind of, within our organization, the clients that we bring in, I mean, we kind of turn them into volunteers in some cases, right? Where it's not by us asking them, it's that they've been happy with the services provided and they've been happy with what we've been able to share with them. That almost, I wouldn't say almost always, but frequently they'll go out and recruit their own people, right? Wherever they're at. Stepping Stones is a great example of that. We have Roger on the call who goes there weekly to give speeches and talks to the clients. We've joined him on 2 occasions with the clinician to talk a little bit about mental health and substance use. And so again, the coordination of it is really effective, because then we're able to help clients out right in the sort of in the moment, right? Which is so important when you're dealing with mental health and substance use, especially. So what we've done is we've been able to sort of create linkages to where we refer to Stepping Stones. Stepping Stones can refer to us, right? Depending on the need, right? So if they're in need of inpatient or outpatient, they can go over there. Then they can, get the resources that they need from over there. And I stay on board kind of as a, someone to help them with whatever they need when they get done. And then they come back with us, and it's kind of a warm handoff scenario. And it's such a great thing. And that can only really happen when we have trust within the agencies, and the clients trust each other, and they trust, sending their friend or their family over to us. And so briefly, we have a number of different staff on our staff that have different, skills and whatnot. We have 3 bilingual staff. We have clinicians. We have Regina and I, who are pretty well versed in a lot of different items and aspects. And then we also have a peer navigator who's in the community, who was once, long time ago, someone that we worked with. Now he's working for us, which is very cool. Let's see here. Let me move this. Okay, so essentially, basically, one thing that's been huge is that we generally like to dress down when we do outreach, right? So that means like not going to somewhere and sort of giving a speech to try to get clients. I mean, we're willing to do that one-on-one. This encourages approachability. And essentially, when you go out on the streets and you ask somebody, hey, do you have HIV? Like, do you really think someone's going to answer you, right? You could replace HIV with a number of different things, STD related, and they're not going to say yes, right? Like I often tell my friends and family, if you go ask like 100 people, hey, like do you have herpes or something, use that for an example, I mean, frankly, you're probably going to get 0 out of 100 that say yes, right? So dressing down is important, and that's just kind of the terminology that I used here in the slide, meaning that we like to meet people where they're at and where we already know that they might be experiencing something that is relatable to what we do. So Father Joe's Village, as we know, Joshua House is there, as we know, that's an HIV facility. So we go there and we don't have to sometimes do the guesswork, right? And we kind of put ourselves out there and then clients can come to us. It's kind of like having if anyone's ever done sales in their life, it's like kind of having a hot lead, right? Rather than cold calling. It helps with the conversation, and it helps get them into the ultimate goal, which is to come with us so we can help with their suppression. I'll kind of talk about some stats later, but we have some cool, exciting stats that we've been able to kind of maintain over the last few years. So the second part and the main part of us, and the main part of what this funding goes to, is for us to practice the U equals U, right? Which is very important. It's very huge for the clients. And again, this incorporates their mental health, their substance use, because how great of a feeling is it to know that your medication now, if you take it correctly, makes you completely undetectable and untransmittable. That's what U equals U means. So it's a huge thing. And essentially, the main engagement goal that we help is using this, right? When we go out and talk to clients, we use this terminology because we want people that have never been diagnosed or don't know their status, which we know there's a lot of them, to understand that, hey, it's not scary if you do know your status, because now it's in a situation to where we can actually do something about it. That's more effective than the old drugs of the past, AZT and the rest of them, right? So how do we do that? We essentially, we get locations, we hit up locations to get reduced fee ID cards. We do other types of things, like we have an agreement with the Mama's Pantry, to where we go pick up 20 sets of bags every week, and we have them in our office so the clients can come and just get food directly from us, again cutting out the middleman, right? And we work in coordination, so when they come, they know it's from Mama's Pantry, but it's one less stop, right? So that helps a lot with keeping the rapport with the client, right? Because essentially our role is, when the client comes in for an intake, I mean, we don't first sit them down and be like, all right, hold on, let me get the paperwork together. It's usually, what do you need? Like, what's going on in your life right now that you need help with, right? Let's attack that first. Let's talk about that first. Then we'll do all the paperwork, right? The paperwork's not why you came. So again, it's little techniques like that where we can help with the outreach. We can help with rapport building. And another example I used here is that if a client lives in East County, so we work with clients all over San Diego County. We're located in Mission Valley, but we work with everybody in the county. So a good example of meeting someone where they're at for outreach is knowing that you're not the only person that does this job, right? The main goal is for this client to get helped, to be involved with their medical care and their doctor. So if they live in El Cajon, then I'm going to look for a place that's close to El Cajon. If they live in Escondido, or if they live in Oceanside, then I'm going to call Vista Community Clinic or somewhere else, right? And that's part of that is if someone understands that you're truly trying to work with them to not make their life more difficult, I think that helps. And then they feel like they can contact you again to ask you more questions, right? Without enrolling them, you might be able to really do some work and really help with the proactiveness of them becoming adherent. Do you guys have any questions as I'm going? I know I'm kind of talking quite a bit here. Hearing none. Okay, so this next part, making the office feel comfortable. So again, this is kind of a different approach here, so bear with me. It's more or less things that we've noticed that have really helped, kind of thinking outside the box with client engagement. So throughout the last several years, we focused on making our office very friendly to the clients, and our staff members are trained and encouraged to step out of the office and offer at least a welcome, not so much a hug or a high five nowadays, but used to kind of be like that. Now it's more of from a 6 foot distance, a welcome. Do you want some water or coffee? So routinely we'll help them with the basics when they first get in, make them feel warm and comfortable. And then generally speaking, we'll have them wait in the lobby where we have a TV. They're able to watch a clip of NHA where we kind of feature some of the news articles that we've had over the years. And then also basically they get a chance to sort of see how we all work together. Like one person will let them in the door while they're waiting for me or a different case manager. Other people will come by and introduce themselves, and it's just kind of a family, makes them feel like family. And this is, again, stuff we've heard from them, so we're not sort of putting these words in their mouth. The approach that we have, right, and this is no knock at Family Health Center because we love them to death. I mean, they're extremely necessary, right, for San Diego County. They do great work. However, they're really big, and there's a lot of locations, and if you Google them, like, you might go to the wrong one, right? That's the thing that we have that we use to our advantage, is that we're sort of like the Ace Hardware, or the local hardware store, where there's only one of us, there's only 8 of us there. We're not a huge company. NHA itself is a pretty big nonprofit, but we're only eight staff deep. Sorry for my dog too, by the way. One of the most important techniques of the rapport and consumer engagement is giving them a feeling that they matter, right? So we have a lot of clients, like I think Chris was saying, that come from other places in the country. San Diego's a destination, as LA is. And so they come here, and then they, sometimes they have nothing. They don't have any family or friends. So going to a place that's going to really sit down and maybe talk to you about your family and where where you're at, where you're just from, and all that is going to be sometimes more important than getting them processed, right? And I use the word process because, whenever we go to the hospital, whether it's Kaiser, Sharp, or whatever doctor you have, you can notice the differences when you're being treated like a number, as in respect to being treated as someone that they're there to listen to. So again, it's one of those situations where we try to use that to our advantage. I mean, obviously, if we're bigger, we could do much more. So it's not really a pro, but we use it as a pro, if that makes sense, right? So, and part of that is that our entire staff is acutely aware of each client's current situation, right? So a lot of us know people by name when they come in. We're like, oh, hey, that's, so-and-so, and just talked to him last week about this. And so we can check in, like, how's your granddaughter? How did Thanksgiving go? Or whatever that might be. This is important, obviously, as I mentioned, because it helps the clients feel like they're being seen. Okay. So moving on to the next slide here. These are some appreciation activities that we do. So this is some of these are from last year that we used, but obviously, COVID changed some stuff. So for the last 10 years, minus last year, we've been sponsored by various agencies. I think Aaron's been a part of a couple of those. Some other agencies as well have helped us donate or bring us items for the clients to have, like, different adherence technique tools, pill boxes, keychains, whatever it might be. And we've been able to do kind of an opportunity raffle at the end and give away, hygiene products and other things that were usually donated from, like, Auntie Helen's or Mama's Kitchen. And then we do gift cards as well. So basically, it's a really fun time where we're able to get some food, and we home cook stuff sometimes and bring it in for the clients. And then we have generally at the end, we'll have like a what are you thankful for type thing, where we go around and we'll let people share successes and hard times. And a lot of the times we end up crying, really, because usually someone will say, like, hey, this was necessary. I needed this really bad, right? And it's those moments that I think are the biggest meaningful moments that at least we have, right? It's when you don't expect it, and you, just by being there, just by nature of being there, you're helping this client in person, like, come out of whatever they were going through. They're battling their own demons that maybe we didn't know about. So during the luncheons, again, like I said, we speak about how grateful we are, and essentially we encourage clients to look around and meet each other. Get to know each other. It's not required, obviously, but we sort of try to highlight the idea that it helps having someone in the race with you. It helps on having someone that you don't have to ask any questions to, but just by the fact that they're there in the room with you, you kind of know some stuff about them, right? Scary in some terms, I guess, for some clients, but I think very beneficial overall. To create community, right? And this is also kind of ties into the first point I was talking about on kind of creating these liaisons of HIV community help, where they go out and they can recruit on their own as well. So, and then looking at clinical case management, this is something that we added a couple of years ago. it's really important. I mean, and obviously, it's again, as stepping stones could probably sign on to. I mean, without mental health and substance use, what is the point of trying to encourage someone to become adherent to HIV? If you're using drugs and you have unchecked mental health, taking your pill daily is the last of your worries. I mean, you could even throw housing on that list too. And so we want to be very clear that like it's an all around approach. We don't want to just come at the client like, why didn't you take your meds, right? Why would you do that? It's so stupid or something like that. Not that you would say that, but ideally we want to use this as a time to also talk about their clinical needs while tying in, hey, once you get this figured out, we talk about this, taking your medication daily is what's going to allow you to physically survive, right? You have to both mentally and physically be present and healthy in order to have a full life, so we use a couple of different things. Our peer navigators will call clients to help them get to group. They'll also go pick them up. We use incentive-based encouragement. That's basically gift cards for every 3 groups that they do or every 3 one-on-ones that they do. We've gotten gift cards from Walmart and other things. We bring food in to the groups. Sometimes our groups range from anywhere from 3 to 5 people. And actually, we just passed a milestone. It was really difficult to do groups on the phone over the last year and a half. We did well, but I don't think we engaged as much as we wanted to. So we just had our 8th straight group of 3 or more people. That's 2 months in a row of 3 or more people, which is really, really good, right? That just kind of proves to us that the system that we're using works and it's helping people come, right? And anyone that does groups knows how hard it is to really get people there consistently. So another big one here is that our peer navigation connection, it's huge, right? They are the staff that are there in the middle of the process, right? So they pick them up, they get that conversation on the way to the office and on the way back. So they get valuable information. And so sometimes the questions that they're asked are extremely important, right? Like, okay, I'm enrolled, I have a case manager, now what? Right? Talking to someone that's been there before is going to be helpful. So that's kind of what our basically our number one sort of positive of peer navigation has been. And then follow-up phone calls, me and Regina, just to kind of keep things accurate and our data accurate, we'll make follow-up calls just to make sure that the clients were worked with. If there's a service that we see that says, this person talked to them for an hour, we'll check in and be like, hey, we noticed that you were, with this staff member for an hour. How did it go? We call it trust and verify. It's not to get anyone in trouble, but it's just kind of to maintain our QI, quality improvement. And so what we'll do is we follow up and just to make sure that things are going well. If the client brings up something, then we take it back to the staff and we discuss it as a team. That helps us, again, kind of just stay current with what we're doing. All right, so the last part here, I don't, how much time am I doing here, Melody? Am I good on time?
You're good. You have like 5 more minutes.
5 more minutes. All right, that'll work. Oh, okay, can you all see that? Going the extra mile? Can you see that? Yeah, okay. So going the extra mile, this is the last slide. These are all the places that we work with. I didn't put all of them. There's certainly several more, but we work with food delivery locations at Auntie Helen's and at Mama's Pantry. So we do a delivery service from Auntie Helen's. If you guys haven't heard or seen what the new Auntie Helen's is doing, they're moving away from thrift store. They're going more into food delivery. Great food, great stuff, perishable, and they hold it all there for you to pick up. I'm happy to leave my number here and explain more to others who might be interested in that. But essentially we pick up 20 bags, we deliver them, all 20 of them in that day. We do it on Tuesdays. We've been doing this for about 18 months and we haven't missed a week. And so that's a huge testament to our peer navigation, to our caseworkers, to everybody for making this happen. This includes cat food, dog food, fruit, utensils, you name it. And then especially now with the prices going up on dog food and cat food and other things, I mean, our clients are really, really helped out by this service. 2 other places that I love and are very close to my heart are Bridge of Hope. If you've never heard of Bridge of Hope, Google it. It's awesome. They basically, any client that finds a new place to live, they let them come one time in their lifetime. But on that one time, they get to pick out a number of different furniture things, couches, beds, clothing, bed sheets, everything. I mean, it's awesome. They run a really good program. I highly suggest you guys to check it out. And then Sharia's Closet's another one that we've gained a really good rapport with. They're a thrift store located over by San Diego State on College Avenue. And they do great work too. They have an online thing where you can fill out all the sizes and whatnot and you pick them up. Again, these are all very important because although we don't, run these things, by incorporating them, by, having a relationship with them, we can call it our own, right? And I would hope that they do the same when they're explaining what we do as NHA, right? Like, yeah, this is, this bag of clothes is coming here. And if they ever hear, like, oh, you're suffering from that, let me call Dallas, let me get you linked, right? So that's two organizations that we really work with. And there's a number of others, Stepping Stones, AHF for pharmacies, and you name it, right? Transportation, we already touched on, so I'll skip over that part. And then the easy to reach, now more than ever, we all have cell phones. We all have Aries on our laptops. We're like mobile case managers now. And it seems crazy to say that because I would have never guessed this would have happened if it was before the COVID-19 stuff. So what that means for the client is great for the client, more work for us, but great for the client because we're always available and we can technically enroll you from my car on the side of the road if I needed to, right? So that helps because in the moment, if we're in the field, we can jump on our computers and we can, fill out an IRP request. We can do something in the moment, which again, we didn't have the ability to do that pre-pandemic. And again, this is all of the stuff that the Human Dignity Foundation has allowed us to do by giving us this funding. It allows us to really think outside the box. That's something that me and Regina really try to focus on, is not, hitting all of our goals and our agenda, but also doing it in a way that incorporates new things, new housing opportunities, new places to get resources. So with that, and I know I spoke a bit there, but if you guys have any questions, I'm happy, Regina and I are happy to field any questions. Or if you'd like us to talk about some successes, we're here for that.
I saw Dr. Harris's hand up earlier. Do you have a question? Jocelyn? Oh, you're mute.
There we go.
There you go.
One of the questions, you're associated with National Housing Association?
No. So wait, do I have mute? Okay, no, we're not. We're actually Neighborhood House Association. So that's just a local nonprofit here in San Diego, about 800 employees, but you might have heard of it if you've heard of a program called Head Start. That's a national group, but we're just the nonprofit here that owns that grant for Head Start. But we are in the social services department, which is probably like 5% of the company, if that. So not part of national housing, but neighborhood house though.
One of the things that a lot of people, and this is they talk of it as a positive. Throughout San Diego, it's a very incestuous group of people. Everybody share with each other. And so I want to say something because I'm no longer involved in San Diego issues, but the world looks at the programs and projects in San Diego as the model. And whether it be an LGBTQ or other housing or social services type organizations. And I would like to welcome you, Dallas. You guys are doing great work already. And you've been, what, 18 months?
Yeah, so our organization's been around for a little bit longer than that, but this is just what the speech kind of looks at is how we've modified how we've worked during the pandemic. So we've been at this for about 20 years, actually. So we've been in the community for a while. But you're right, though, because 3 years ago, we moved to a different grant. So now we're in central San Diego. We have a much bigger grant, much bigger reach. We used to be located in Southeast San Diego in the 92114 zip code. So much littler organization there. But to your point, we've added substance use, mental health groups, and a lot more services, basically.
Thank you. Thank you.
Yeah.
Thank you for that question. The floor is open if anyone else has anything to ask or add. But I definitely would love to hear any success story. I'm a sucker for those.
Sure.
Oh,
Do you guys have?
I have a good one.
Yeah, go ahead.
Oh, hi, this is Regina again. So I was a case manager for 7 years before, of course, becoming director. And I had this one client who I won't name. And, when I did the intake, he was homeless. He was using substances and on SSI. But then after about maybe 5 years or so, he became employed. He drives for MTS. So he drives one of the MTS buses. And he comes by to see me still about once a year and just gives me updates on how he's doing. He has a new car, his own apartment. He's driving for MTS, and he comes by about once a year. So for me, I think he's a really good success story. He's doing really good for himself, and thinking about retirement in about 10 years.
Amazing. That's amazing.
Yes. So happy for him.
Absolutely. We have a wall of cards of clients that have moved away but stayed in touch. So it's kind of cool. We sometimes we'll get stuff from them in the mail. We just recently got one from a client who is working for like the Omaha school district or something in Nebraska. It was like a picture of him, and he included this like Yelp review where someone had gave him like a positive Yelp review, which I thought was super cute. I've never seen that before, but I was like, that's cool. We should all do that. We should all like not pay attention to the negative and just find the positive and print that and just put it on the wall. That was cool. But so I'm going to share one, and I'm curious to see if Pam and Chris can name this. And of course I won't name anything, but I'll give you some details. I had a client of mine. He's been a client for about 5 years. He's still a client. He has been arrested multiple times for car theft and a number of other things, drugs and related. The last time he got arrested, it was for what I thought was stealing a car, because I checked who's in jail, and that's the first thing that I saw. So I was like, oh man. Come to find out that he had rented a U-Haul to move some stuff out of the place he was living and was homeless, and then decided just to not return the U-Haul and sleep in the back of it. And then they found him and they arrested him for stolen property in the car. The U-Haul put out an alert on it. I didn't know that. And when I heard that, I was like, what? It kind of tugged at my heartstrings there. Like, wait a second, this is something he's done in the past, but it's clearly something that isn't the case this time. So he got very lucky. The lawyer was actually the one that called me. Because this is a guy that's been arrested a few times, and every time he did, he'd send me a letter right from jail right away, like, sorry. As why he's apologizing, I don't know, but like, I think that you can kind of tell the person by how they sort of like, first approach a bad thing that happened, rather than like, it wasn't me, man, like, don't listen to them. He was like, I did it, I messed up, so he's one of those kind of type of guys. So for some context, but so I talked to the lawyer. The lawyer's like, yeah, this is what happened. Like, do you have any, do you think that's the case? And I was like, yeah, I think that's the case. I was shocked by his arrest. So they ended up getting him out. We're able to get him out of jail on a program. He went on to a 2-year or a 1.5-year program, very structured, strong program through Second Chance. He was at Stepping Stone doing some outpatient for like 6 months, living at Stepping Stone for a couple months. I was able to help him with some rent for a couple months. Over there. Then he moved out, and now he drives party buses for like rich people that come to San Diego and go to like Del Mar, and he takes them around. He sends me pictures like of him like on the golf course, like it's always in his bus, and it's like, it's amazing. And I just watched graduation that he did in one of the programs he was in, and it was just so cool. He was giving a shout out to everybody, and it was just so like cool to see this full circle, of someone that has used multiple agencies and has came out and is doing well. He has his own apartment. He has his own car. He has his own job. He even does like side jobs. He even like does app jobs, like on this app where he just picks up like shifts. And it's like, he does more work than I do. I mean, he's doing more work than I am. It's like, it's crazy. I'm like, man, you've came the whole circle, man. It's really nice to see. So again, there's so many stories like this that I'm sure Pam and Chris could fill a book. I mean, because we get clients from them all the time that give us the stories from there, and then we just kind of continue the legacy, or vice versa, right? But that's the name of the game, is looking at the positives, and if it's a negative, then telling them just to try again until it turns positive, right?
We are so grateful for the work that you all do. We want to be cognizant of time. It is 6:30 on the dot. Jocelyn, did you have something quick to add? You're muted. There you go.
Okay, I got it. one of the things, I'll just tell you a little story about Stepping Stone. When I first came back to San Diego in 2005, I was in the emergency room at UCSD, and I was looking for some place to send my LGBTQ clients in the emergency room. And I checked things out, and I knew about Stepping Stone a little bit from when I was here before. And so I called them, and they said, yeah, we take LGBTQ clients, and as long as it's substance abuse and stuff like that. So I went back to UCSD and I asked them, I said, why isn't this on our outreach list? Why isn't Stepping? They said, well, we don't deal with that. Okay. So I said, yes, you are going to deal with that, because that's discriminatory if you don't. So I called, I don't think it was Chris at that time, because it was about 2006. But whoever I talked to, I said, you're going to get some patience from us. And it's going to be fairly quickly. And so we did. We changed the policy, the procedure, not only outside to send our clients to somewhere where they would help. We changed it inside so that transgender people could have dignity and respect at UCSD. Now, was it rapid? No, we still aren't there, folks. Okay, and I'm in contact with UCSD all the time because I'm still doing research in infectious disease. So, but as soon as we started being able to send, and this was from Hillcrest, to send LGBTQ to Stepping Stone, we noticed that we had fewer HIV LGBTQ folks coming into the emergency room because they didn't need us any longer. They knew about Stepping Stone, and we weren't doing them any good. So they just, I guess they called and went directly there. So anyway, that's my story, and I love Stepping Stone. I've never been a client. I should have been when I was younger, but didn't work out that way.
Thank you.
So
Thank you, Jocelyn.
that's okay. I'll be talking to you and Pam. Just
Okay.
one of the things, I don't deal with individuals anymore. I deal with systems. And the thing that I've got to look into is San Diego County has the best programs for HIV, for the homeless, for housing, and for all those things. And I hear that from all over the nation. And yeah, you are a destination. I'm sorry. People are loading you up, but just keep doing that great work that you do. And that's to Dallas and Regina also. I'm so proud of San Diego that when I talk about it, I'm sure that I've got a glow, because San Diego has done wonderful things over the years. I don't know what it is now, 115 years that I've been back. It seems like it at times, but
I
okay.
couldn't have said better myself. It is 6:34. Lena, do you have some words to wrap up this wonderful meeting that has brought us together?
Yes, of course. Thanks. I know almost all of you, but I'll introduce myself. I'm Lena Mohi. I'm the Chief Operating Officer at the Human Dignity Foundation. I love working with the grantees from the HIV Collaborative. I know we started before the pandemic, we started to actually get to meet in person and do networking sessions quarterly, so that just like you guys were saying, how you refer to each other, you send clients your way, and that's my wish, is that all of the organizations, at least that are grantee recipients, and if we want, we can get to a point where we include more, but have them come together and share, in just a short few words, what they do, so that, you go, oh, I've been looking for somewhere to send my clients that need food or just need to come pick up something, and then you're right there. And it just makes it even better because, you know, sometimes there's those smaller organizations that someone hasn't heard about yet, and it's a perfect fit to work with. So I appreciate you guys working with us. We will be sending out requests for proposals within the next week or so for next year. We did get a larger donation from the Red Dress Party, who, as you know, funds the HIV Funding Collaborative. So we will hopefully be able to award larger amounts this year, as COVID kind of hurt us last year. So look forward to that email I'll be sending out, and feel free to reach me if you have any questions about that. And I just appreciate, you know, you guys, everything that you do for the community. You're one of the biggest things that we can share and brag about, because what you do is just unbelievable.
This is Roger. Can I add something really quickly?
Sure.
Yes. Hi, I just wanted to say I had the chance to go through Stepping Stone 4 years ago this time. And today, you know, as Dallas mentioned, I go back and forth between Stepping Stone and a lot of other organizations, and I serve on the planning group. I just want to say that Jocelyn is right. The work that they do is amazing. The work that Dallas and Regina do is truly amazing. And I'm just really happy to be on this call tonight with you all.
Thank you. All right, so unless anybody has any last minute words, we are past our time, and I know you probably have to get to your homes and relax for the evening. So thank you all very much. Melody.
Bye.
Bye.
Thank you.
Thank you. Bye, everyone.